Who among us couldn't use another chance, another opportunity? Well, that's part of what they do at Crosspoint. It is a San Antonio organization that I think not a lot of people know about. When you say Crosspoint, what do you think? Well, we're going to hopefully change that today. Dr. Kevin Downey is the president and CEO of Crosspoint. He's also a friend of mine. I am very happy that you could join us. I know you had your community restoration luncheon today that I was pleased to be part of. Talk about Crosspoint. What do you tell people when they're like, I don't know what Crosspoint is? What do you say to them?
Well, I start off by telling them that since 1963, Crosspoint has been providing transitional residential support services for all kinds of vulnerable citizens. And a lot of people don't understand what transitional services are, but we are basically the linking pin for people that are coming from one situation where they need help desperately, and we get them on the road toward independence and self-sufficiency. A lot of people know us. The ones that know us often are about our prison re-entry programs or our homeless veterans programs. Mm-hmm. But in recent years, Crosspoint has endeavored to meet the evolving needs of our growing community. And in doing so, we had to come up with some very innovative programs to address the changing population.
And you all do deal with and help out so many different groups, like you mentioned, veterans, people getting out of the jail who are looking for a way to transition back into normal life. But women especially, that's a big initiative for you all right now. You already have Casa Mia, so talk a little bit about what that is.
And why you decided to do that, Kevin.
Okay, well, I would start off by quickly saying that a few years ago, we started out with Behavioral Health Transitions, which is a program that does transitional services. But this is for individuals who are either heading toward jail and we divert them, or men who were being released from behavioral health hospitals and really had nowhere to go. So Crosspoint started doing transitional services for them at the end of 2017. And then in 2018, to deal with the opioid crisis, we opened up Casa Mia, which is a residential support program for women who are pregnant or parenting that have substance abuse disorders and their babies. So when women would give birth and the babies were substance exposed, CPS, Child Protective Services, would often take the child away. And Crosspoint built Casa Mia with the help of UT Health School of Nursing to give these young mothers or pregnant women an opportunity to go through treatment and stay connected with their babies in one fashion or another. And it is a very nice 20-bed facility in the Monte Vista area. And UT Health provides nurses over there to help them. We work on them with life skills, with nutrition, with relationship building. But the issue was, and Steve is aware of this, that we could only serve opioid addicted mothers. The problem is, in this city, there are women who need help with other issues, whether it's they had been addicted to cocaine or methamphetamine or alcohol. So we decided, and by we, I mean Crosspoint and UT Health School of Nursing, to look for property to build a 4-acre campus where we could expand this model and serve mothers with all different kinds of substance use disorders.
It's an amazing program because you want to talk about an incentive to go through the program and get clean and sober. They have their child with them a big part of the time as they go through this program. It's like their incentive is right there with them in the crib. It's an amazing program.
It absolutely is. And we've found that one of the things that has been really good for us is the fact that these mothers are together, that this offers a unique opportunity for peer support where they help one another. And we have seen in our first few years at Casa Mia that 75% of the mothers are reunited with their babies when they leave us, which is a really good number because you think about it, if they weren't with us, number one, the babies would have been pulled away. They probably would have gone to a very expensive NICU experience. They could be fostered out. But this gives the mother the opportunity, the cushion, to begin getting the help, the resources, the guidance that they need to have a self-sustaining life. And also, the babies often will get the opportunity to visit with mom on the weekends. And then if everything's working out, they rejoin and the mom and baby gets to leave together to start their new life.
Wow.
Yeah, to be able to maintain that connection while going through such an incredible change has to be so important in terms of recovery and making that transition. You talked about the land that you all have looked for this new part of your initiative for women who have substance abuse issues. This is going to be the Women's Wellness Campus. Is that right? Tell us what's to come there.
Sure. We purchased property in July. We initially purchased 3.4 acres. We subsequently bought another 0.4 acres next door. So it's going to be a 3.8 acre campus. And it is so cool because not only is it the transitional care that we have at KSAT, but the UT Health School of Nursing has helped us design, and they are going to staff a primary health care unit for moms and babies right there on the campus. There's also going to be a nursery. So those babies that are also undergoing withdrawal can be at the nursery with their mom. And research has shown that both baby and mom does better if the dyad stays together while they're there. The other part of this, so that's a 10,200 square foot residence. We will then, after that, build 3 more 6,000 square foot residences to assist homeless female veterans, to assist women being released from behavioral health hospitals who have nowhere to go, and women who have criminal justice system involvement. That could be Esperanza Court, it could be drug court, but they have a place to go where they get professional care 24 hours a day for the amount of time they need until they're ready to live on their own.
It's amazing. And at today's luncheon, just hearing the graduates from so many of these different programs, including KSAT, talk about their experiences and how they've turned their lives around is amazing. Dr. Kevin Downey is the president and CEO of Crosspoint. If people want more information, I know you're going to need money to build this building. CrosspointSA.org, is that the website?
It's CP, like Crosspoint, CPSATX.org. Please join us on the website. You can do a virtual walk through all of our houses, including KSAT, to get an idea of what life looks like in a transitional care environment.
CPSATX.org.
That's it.
Dr. Kevin Downey, appreciate your time.
Thank you so much. I appreciate you having me on.
Absolutely. We'll be right back.